last week, one to the Osher Institute, and one to the Healthcare Transformation Council of Idaho. And again, as you guys know, I'm a big fan of the Affordable Care Act. I did a lot with it. That's why there were all those TV and newspaper interviews. I was the president of the Academy and chairman of the board through the whole creation of that. And as I've mentioned to you in the past, I had 6 meetings with President Obama and his senior administration, as well as I testified to different congressional committees on 18 different times in those 2 years. So a lot of activity, a lot of trips to Washington, D.C. I tell you, I don't miss that. So I couldn't be more thrilled when Joe Biden then becomes the president, because I know it'll be more of the continuation of what we set out to try to do, which was to help transform healthcare for all the reasons we needed. And all the slides that precede this are kind of setting the stage and context, and I won't go through all of those with you. So the big top level things is the assault on the Affordable Care Act will stop. As you all know, Congress attempted over 60 times to stop the Affordable Care Act or to gut it in significant ways. And much of what President Biden has done in the early days he started to reverse things with executive orders. One of the comments I've heard him say that I really like is that I'm not trying to change the law, I'm just trying to change bad policy, which was nice. So he's started to put in a lot of things, as you all have seen, in regards to travel bans, wearing masks, helping sort out the vaccine distribution nightmare, et cetera, et cetera. I do want to just really focus that on, even though we've got a lot of work to do with healthcare reform, everybody's exhausted right now. They're exhausted because of COVID-19, and COVID-19 is going to be our front and center issue for at least the first year of his administration, just trying to get this totally under control. It's taken up all the oxygen and energy. It's a 24/7 push, not only around masks, but the vaccines, but also, as you guys know, it's a race against time with the variants that are emerging. And it's a simple calculus. Really, the more infections there are, the more chance for mutations there are, the more variants that'll appear. So the longer this goes, the longer this goes. The problem is when you have a 50% asymptomatic rate, you get a lot of people infected who don't know it, and they can all produce potential variants. So we've got 4 major variants now, running across the country, and who knows how many more potentially that we don't even know about. So it's a big deal. So I'm going to spend the rest of the time, though, not talking about COVID, and talk about the Affordable Care Act now in terms of the refine and refocus. So a big deal for Biden is healthcare as a basic right. Most of us absolutely believe in that. Most of Europe is normed on that principle, right? We're the only industrialized country that really struggle with the recognition that it is a basic right. We're split almost 50-50 on surveys over this. And it's exactly why we lead to this split attitude about, is this something we really need to invest in or not? With his administration will become a real focus again back on the patient protection aspect of the Patient Protection Affordable Care Act. So one of the big provisions, of course, was to expand coverage. The Commonwealth Fund had really boiled it down to 2 things, and 2 things only really drive major quality health outcomes in populations. One is that everybody has some sort of coverage, however that is gained by people. And the second is they have a usual source of care. Those 2 in combination become really powerful to people navigating both health and healthcare. So the expansion of coverage will be a big deal. Right now, we're at 30 million uninsured, anywhere in the range of 50 to 80 million that are underinsured. We've moved forward on this. Back when the Affordable Care Act was created, It was 50 million uninsured. We've at least dropped this down to 30 million, which is about 9% or so of the population. Now it used to be up around 18% of the population. It had gotten as low as 7% before COVID. And with all the unemployment issues that happened with COVID, that number has now gone up to about 9% or about 30 million people. There will be a push to expand Medicaid, especially in states that haven't done it yet, and to expand it even further in states that have. As you all know, there's talk about dropping the Medicare age down to 60, which brings in a lot of people. And for all of us in healthcare, that age between 60 and 65, a lot of things happen to people. And a lot of people put off care between that age because they want to wait until they have Medicare. They want to have some sort of coverage. So a lot of people hitting age 65 really come into it with a lot of pent-up demand, right? They have a lot of issues, chronic knee and back problems they've put off. And then so the major impact on the system is quite substantial. If we drop it to 60, then we can start working proactively with people, keeping them healthier, getting these things under control. Actually, it'll save the system tons of money. The public plan option will still be a big deal. Edward, I'd love to hear your thoughts. I'd mentioned that last time to you. How does a place like Pacific Source look at the public plan option as another option for people on the exchange to take a public insurance plan that maybe will provide expanded coverage, maybe even price pointed to a point that it's the best value on the market? How does that impact insurance companies? How do we all deal with that? I still remain convinced, and the Biden administration does too, that a hybrid system is in order. It shouldn't be all or none. It's not a total national health insurance he's moving towards, but more of a national health insurance so that it's still a balanced system, more of a hybrid system with multiple opportunities for people. Access becomes an issue. That's why we need to build out the front end of the workforce. Let's see, I'll move on. Right now, healthcare in the nation is costing about $11,000 per every man, woman, and child in the country. So there will be a huge push to drop cost. Nobody disagrees with that. We need a lot more on the front end of prevention. We need to move away from sick care to health care for all the reasons that we know. There needs to be much more integration and coordination of the system. Ultimately, right now we're cooking at about 18% of the GDP in healthcare. It needs to drop to about 15% and even lower if we can get it there. A lot of the European nations are running about 7, anywhere from 6 to 8. 9%, with 7% being about the average. So we're almost twice as high and have worse outcomes. As you all know, about a third of all the healthcare dollars is just waste in terms of duplication, redundancy, lack of coordination and integration. Is it really even needed? Does it lead to more harm? The change in subsidies to help with the coverage, there'll be an expansion on the upper end. Even they're talking about well above 400% of federal poverty, which it now is at, to expand then people that could qualify for subsidies. The public plan option I referred to, insurance reforms in terms of insurance, pre-existing condition issues, especially around COVID, which was starting to become a big issue. And then again, to drop that administrative overhead. I think, Jim, it was you that was sharing Don Berwick's statement that when he was the director of CMS, he was responsible for 110 million lives, and their overhead was 3% compared to the insurance industry average of about 15%. Just a couple more things and I'll stop. What else will change? There will be a progressive move towards coverage, as I just said, either by Medicare or Medicaid. And when you really look at how much is covered now, about 50% of the nation is really covered by single payer. Federal government is a payer when you sum those groups of people together. Telehealth will continue to have a lot of focus Edward, I know we've had the opportunity to talk with you. You've been, I have to compliment Pacific Source. I've gotten to know all the insurance companies pretty well. Pacific Source is by far the best folks in terms of innovation, outward thinking, just doing a really good job. I've worked with all three, Edward. I'll just share with you. I think I've mentioned this to you personally as well in a letter recently. But for our personal health insurance, for our FMRI, we're an employer-based insurance plan for my company. And I've worked with Blue Cross for a while. I've worked with Regions for a while. I've worked with another company out of state for a while, and I've worked with Pacific Source. And hands down, Pacific Source has been the best partner with us in terms of moving towards many of the things that I'm talking about in these slides. There will be an increased focus on quality and outcomes. I'm glad to see CMMI under the Biden administration will be recharged around innovation. At the end of the day, we're all looking for value, better value. And of course, the best definition I've ever seen, because I love things when they're just really simple and make sense, is quality divided by cost. We want to drive up quality. We want to lower cost. We want a better value system. And of course, what we've got to get away from is fee for service. There'll always be some need for fee for service. Don't get me wrong, but it shouldn't be the predominant mode. It just sets up perverse incentives, as you're aware of. Just a couple other things. There'll be a continued refocus on public health. I was very happy to see that one of the executive orders that President Biden signed was to rejoin the World Health Organization. And guess who the ambassador from the United States to the WHO is going to be? It's Dr. Anthony Fauci. So, you know, you couldn't have, I think, a better person that's going to be in that role. There'll be a total focus on the social determinants of health. Sorry about that misspelling of determinants there. And you're all aware of the poor living sicker, dying younger. The COVID-19 mortality really exposes much of the social determinants with what's happening. And look at the mortality rate increases for those groups of people that are less fortunate. Doctors and scientists will be listened to again. I think that's been one of the things that's been so frustrating with the Trump administration. It was just the denigration of expertise. Somehow it was wrong to be an expert. And somehow it was just an elitist totalitarian thing in some way. It just boggled my mind. One of Joe Biden's big deals is the war on cancer. So there's going to be renewed emphasis here, you know, post-COVID. As I mentioned, that'll be the emphasis initially. There will be continued movement to drop the costs of pharmaceuticals. Gun violence research will expand even more. Finally, the gag order has been lifted back actually during the Trump administration. But it's, you know, kind of been so beat down. There'll be a whole lot more as we try to get this under control in terms of what's going on with gun violence. And that's long, long, long overdue. There will be a push by the Biden administration to make sure there's no efforts on balance billing and surprise billing to patients. It's a big deal for Joe Biden. I couldn't help put this in, and because there's always naysayers out there that say, well, you know, that's all nice, Ted, but you know, why is this going to move forward in a split Congress? Well, really, when you look at it, about 80% of this is agreed to by the Republicans as well. Nobody's talking about having a higher cost system. Everybody's in agreement on lowering the cost here. Nobody's disagreeing with we want a higher quality system. Nobody's in disagreement around better prevention and wellness is a goal. That we need integration and coordination of care, be that at the primary care level with the patient-centered medical home or at a larger systems level through accountable care organizations. And ultimately, we can't afford not to do this. That's a big deal. I just threw in a couple things about Idaho. We'll continue to work hard to get COVID-19 under control and control costs in the state. We're really still struggling on the Medicaid issue here, sadly, in terms of the coverage of this. There's a lot of work that will continue on value-based care and telehealth. There will also be work done to continue to build out the physician and nursing workforce. Again, we're right at the bottom of the barrel in terms of the number of physicians per capita in the state. There will be continued work around integration and coordination of the delivery of care. Public health departments, it's going to be really interesting to see what comes from the pandemic in terms of both restructure. There's bills to restructure public health and how it works in this state. So it'll be interesting to see. There'll be a renewed emphasis, I believe there already had been, on mental health, but the pandemic just really exposed more of our underbelly in terms of problems we have. And then, of course, we'll continue to do social determinants work in the state too, albeit at a slower pace than at the federal level. That's it. I'm going to just stop with that. The rest of this goes into some other things in terms of issues for that audience. And Jim, I'll stop there and open it up to you all for comment and additional thoughts.